In many careers, if you switch jobs every year, you would be called a job hopper. And in nursing, if we get that resume, we look and we say, look at all the experience this person has. So nursing gives you lots of avenues to never get bored.
Stroup Hall at Fort Hays State University is expanding as the Allied Health program moves in with the nursing program. I'm Becky Kiser, Hays Post Eagle Radio News reporter, and I'm talking with Crista Beiker and Jenny Manry, along with President Tisa Mason, on this episode of the Hays Post podcast.
Just a shout out to the community for showing up for the groundbreaking. It was a really fun opportunity to gather and celebrate this amazing opportunity for Fort Hays State. And so since opening the doors in 1981, Stroup Hall's been the cornerstone of nursing education, which is so critical today, especially in our rural communities. And our nursing program has just been magnificent in training up people specifically for rural placements. And what's really exciting about this project is we're bringing over Allied Health as well, which is our medical diagnostic imaging programs. Sometimes not everyone knows what Allied Health is. And that's going to create this really great partnership for our students and our faculties in terms of how all of this comes together in training up professionals in the medical field.
Wonderful. Well, I'll have you introduce the guests, and then we'll dive into what they know about what's going to happen and take a peek at the growth we anticipate.
Fantastic. Well, we have Dr. Jenny Manry with us, who is our Department Chair of Nursing, and Dr. Crista Beiker, who is also our Chair of Allied Health Programs.
Wonderful. Welcome, ladies. And I've heard nothing but your praises being sung this morning about what a great faculty you are and such leadership that's shown. And I know we've heard in the news over the last couple of years about the growth of the nursing program at Fort Hays State Allied Health, and everybody knows that there's a nursing shortage, not just in this region, but nationally, and this is so important. So let's talk a little bit about, Crista, let's start with you and talk about the nursing shortage. And well, I guess maybe, I'm sorry, what I wrote down your directions wrong, your titles wrong, I'm sorry. But let's find out why, I guess, there is a nursing shortage. I know that a lot of nurses are retiring now.
I think that we just have an increased need in rural Kansas, especially for nurses. A lot of our rural hospitals are needing nurses, and just more placement for nurses, more opportunity for nurses in the workforce, which then means more opportunity to educate more nurses. So,
and are young people aware of this?
I think that there's a lot of opportunities across multiple fields. Krista's here with the opportunities in Allied Health, so I think there's a lot of competing opportunities for students to choose, and nursing is definitely one of them. So we try to get the word out.
Crista, let's talk about Allied Health. And Tisa touched on what that means, but to somebody who's going to the nurse's office or the doctor's office, what are they looking for? What kind of treatment is that?
When we're talking about medical imaging, which is part of the Allied Health field, we're talking about any imaging modality such as ultrasound, x-rays, CTs, MRIs. So those modalities that are going to basically figure out what's wrong with the patient and allow the physician then to move forward with any sort of treatment plans following that.
And do you have equipments or modalities that students can get the hands-on training? I know Fort Hays State's really big on that.
Yes. So our two core programs include our radiologic technology program and our diagnostic medical sonography program. We have equipment on campus that they use for the first year of their program. So they get a lot of hands-on experience on campus. And then the following year, they actually go to a clinical affiliate and they work one-on-one with the technologists under their supervision for really the full year in a full-time capacity, making them very competent when they leave our program.
And we look to the future and people who are interested in getting into nursing. Are we looking at people who are, bright-eyed and bushy-tailed right out of high school, or are you able to work with people who maybe need to update their credentials who are already in the industry?
I think that's a great question. We have multiple programs at Fort Hays, and we have our on-campus pre-licensure program, which is for anyone who is looking to become a nurse and get their RN. We also have our RN to BSN program, which if you go to a community college, but then want to advance your degree, get a bachelor's degree, maybe go on and get a master's or a doctorate degree, then you can get that bachelor's degree at Fort Hays. That's a completely online program. We serve students all over the country. About 250 students this year will go through that program. About 88% of them are from Kansas. So we have a big population that go through that program. But as far as our pre-licensure, who's going to become a nurse, we have students that are right out of school into later in their career. So there's not really an age definement. If someone wants to be a nurse, they can come at any time.
And I have to ask the question, I kind of hate to do this, but are men still interested in becoming nurses? It's been dominated by women for so long.
We do have several men that become nurses. And in fact, this year we're really excited. We started a National Men in Nursing Association, and Terry Seek is leading that. And we're really excited to have that chapter here on campus.
Oh, that's great to hear. I'm curious. Let's talk a little bit about with Allied Health. And the exciting thing is, as we said, we're moving into Stroup Hall. What will be the advantages of having those two areas so close to each other now?
Yeah, well, in the healthcare field, nurses and radiologic technologists work quite a bit together. And so before going out to their clinical affiliates, this will give the students a chance to work together in different scenarios, such as the ER or inpatient settings, any of those situations where they can work together and be more comfortable then and feel a little bit more confident going out into the clinical field, having worked with other professional areas. So there'll be lots of advantages in that realm.
And is it good to have the faculty, or will there be more synergy between the faculty areas?
Definitely. And I even foresee us maybe collaborating on certain courses that would overlap for the two. So I think it will be a great advantage for us to be able to do that as faculty members as well.
And you touched a little bit about working with the equipment, but I'm also curious about working with the industry, and you touched a little bit about that. But are there those opportunities to work with, especially in rural areas that really do need the help and hopefully are able to hire somebody from Fort Hays State? Do we get the opportunity to work with them, and is that a good synergistic partnership?
We have a great partnership with multiple rural hospitals. We send our students out for their capstone experience and their rural experience. They do about 50 hours in a rural hospital. So we try to expose students. Our philosophy is that if you haven't seen it, you may not be interested in it. So by putting students in those rural hospitals, then it encourages that. This in about 2 weeks, we'll be having our employer spotlight. We will have over 250 students on campus, and we've had 26 hospitals sign up. The hospitals come, and rather than a typical career fair, each hospital is given 2 20-minute slots. They're able to bring maybe an alumni nurse, someone from their benefits, different people to talk about what makes our rural hospital different. Why would you choose us over someone else? And the students actually get to sign up for 6 different time slots. Which hospitals am I most interested in working at? And then get to go have those one-on-one conversations with those employers. The employers love it. They say it's one of the best events they attend all year, and the students love it too. So we're really excited to have that back on campus this year.
That's wonderful. That's a great idea. The nursing industry, and specifically, I know we've talked about it being a portable career because everybody needs a nurse around, and we've talked about it being a well-paid career. Is it still as lucrative, as exciting a career as it's always been?
I think the nice thing about nursing, I like to tell our freshmen that even if you don't want to be a nurse, you should be a nurse, because if you like business, if you like being a teacher, if you like counseling someone and sitting down and talking to somebody in the mental health arena, there are so many different avenues. You can get out and you can do work comp nursing or telehealth nursing, and you can do that from your home. So there's so many different options, and they all pay very well. So I think that it comes with a great salary and just an opportunity. I like to say that in many careers, if you switch jobs every year, you would be called a job hopper. And in nursing, if we get that resume, we look and we say, look at all the experience this person has. So nursing gives you lots of avenues to never get bored.
Absolutely. Well, let's talk about Stroup Hall itself. As I understand it, and we had the groundbreaking recently, it's going to get bigger, both taller and wider, I guess.
Yeah, so there is an expansion on the east side of Stroup Hall, and The ground floor expansion will include the nursing department. And then the second floor of that portion is going to be the allied health department, which we are super excited in allied health because we have really outgrown the spaces we are in. And so we have increased by 50 to 60% in the number of students in our programs.
Wow.
So this is a really crucial time for us because the new space, the lab spaces will be larger. We will have more classrooms that we will be able to establish for our department as well. And so along with that, there is a lot of student interactive areas, collaborative areas, which again will be beneficial in bringing both groups together as well as just for the groups individually.
That will be nice to see. Absolutely. Do you have a date of completion when this is supposed to be ready to move into?
Well, the expected or anticipated date of completion will be at the end of 2026. So hopefully December 2026 with us hopefully moving over there during the break between sessions. And then we'll hopefully be in there by spring session of 2027.
Oh, we'll look forward to that. Tisa, I know you've had a lot of support, including from the state legislature for this project. It helps everybody in Kansas.
Yes, and so we can't sign off without saying thank you publicly. Once again, you can't say thank you enough to people for the Kansas legislators' support, as well as Governor Kelly put this in her bill as it went through as well. This supports not only the $15 million for the building, but there's also some ongoing money for some new positions and some help with simulation equipment. And I know both Jenny and Crista have been really proficient in getting grants and other supports for the simulation as well. So we really have a lot of partners in this. And I think because everybody knows how crucial it is to even the survival of our rural communities, I'm so proud of the work that they are leading.